Hello, my fellow classmates and Professor Tavanti. My name is Felix Teper, and today with me I have Rina Seerke Teper, who is a first-year resident at the University of California, Riverside. Today we will talk about the importance of having free clinics across the United States. But before I ask you a few questions, I came across the following research. There are approximately 1,700 free medical clinics scattered across the United States. In 2008, free medical clinics treated more than 4 million uninsured patients with no federal money. 1,200 federally and state-funded community health care centers have treated 7 million patients. Free clinics are totally dependent on volunteers, monetarily dependent on individuals, businesses, civic groups, churches, fundraisers, memorials, grants, donations from patients, and local United Way. So here's my questions for you, Rina. The first question. Why did you decide to go into medicine?
Hello everyone, thank you for interviewing me today. I decided to go into medicine because I really like helping people. I'm really interested in physiology and healthcare, and I really believe in finding a special and individual approach to everybody that will come to me as a patient. And I really want to help people gain an understanding of how to really take better care of themselves and get a control of their health and really be healthy.
All right. At what age and why did you decide to work in a San Francisco free clinic?
I started working at the San Francisco Free Clinic at the age during college. I decided that I wanted to go into medical school and I wanted to have a better understanding of healthcare, and I wanted to have some sort of, I guess, an insight on how to treat patients and how clinics and the healthcare field works. So I decided to go to the free clinic to volunteer and work later on, and to just really see how to take care of patients firsthand before I go into medical school, and decide that that's the career for me.
All right. And what is Healthy San Francisco?
Healthy San Francisco is not really an insurance. It is for those who are 18 and over and who have an income of up to 400% of federal poverty level, and those who are not eligible for Medi-Cal are eligible for Healthy San Francisco. It doesn't really provide a really huge coverage of physicians or particular services. It's just there for kind of like, I guess, preventative care, just for regular issues like blood pressure and just some, certain medications, that you need to be prescribed, and certain little urgent care issues. So it's not really insurance, and Healthy San Francisco and the San Francisco Free Clinic really encourages everybody to really get insurance, because, that is important right now with the Affordable Care Act, and people are going to get fined if they don't have health insurance that they sign up for at the certain times that health insurance should be, signed up for, that the government provides.
All right. And what about the particular San Francisco free clinic that you worked for? How was it being funded?
San Francisco Free Clinic is funded by a lot of different sources. There are hundreds of doctors who provide volunteer services. There are pharmacies who donate medications. There are people who provide just money. And there's physicians and specialists who provide, a certain amount of slots, maybe per day or per week, to really give free services to those who need it and who get referred by the free clinic. So it's a huge network of people who really volunteer time and money and really believe in providing healthcare to those who can't even afford it. So, all
right. What is the cost benefit of going to the San Francisco Free Clinic?
It's interesting. If you look at it from a certain point of view, a lot of people who go to emergency rooms and decide to get health care, they decide to get it last minute when it's too late, God forbid. But, when it's something that's an issue like, something chronic or cancer or something that's, incurable, or something that needs emergent treatment like a surgery or, a huge test or something like that, and it's very expensive. And I think that going somewhere or having some place like the free clinic really provides a place where people can go to get preventative care, where they can go to take care of their issues before they even get so bad. Maybe they have a little bit of an ulcer on their foot, and before it becomes gangrene, or before, they have an artery that, just is blocked off completely and they lose their leg, they can go and say, hey, like, I lost some feeling in my foot, like, can you just check it out? And they won't feel like they need to wait till the last minute to go because they can't afford healthcare. They can go and they can get their cholesterol checked out, their blood pressure checked out, do preventative care before their issues get to the point where then other people have to, the taxpayers have to, be able to pay for people who would just wait till the last minute and go to the emergency room who can't get care anywhere else. And also physicians. I feel like, physicians aren't going to, spend time taking care of people who can just go to the free clinic and get their blood pressure taken care of and get pills for it. Whereas, people with really high blood pressure headaches, they go to the ER and they say, oh, my blood pressure is 200 over 150, where they can just go to their physician, take care of it early and not take the place of somebody else who really needs emergent care.
Okay. How many patients do you typically receive per day or per month?
Oh, in the free clinic?
Yeah.
I mean, it's really hard to tell. It really varies. We try to see as many people as possible. We've seen, I think, over 100,000 people since the clinic's open in 1993. It depends. Some days we have a diabetes clinic, which is really packed because we try to see as many diabetics as possible because they have so many complications. But, maybe about 8 to 10 patients a day we try to see.
And how many days per week is the clinic open?
Monday through Friday.
Monday through Friday. And what are the qualifications for becoming a patient at the free clinic?
You cannot have insurance. That's Medi-Cal, Medicare.
Any type of insurance?
Yeah, you have to be completely uninsured. Although, now with the Affordable Care Act again, the free clinic really encourages people to get insurance because, of course, they're going to have much better care availability with insurance, whereas the free clinic can only, provide a certain amount of available volunteer spots that the specialists can give, and a certain amount of tests that they can do, but it's definitely still available.
So are you saying that there are times where you have to turn away new patients because of the lack of funding or of time, or?
We don't turn away new patients. If we have the time and the space to see them, we definitely do. We schedule them, at a certain slot, but if the specialists don't have enough slots in a certain month to see that many patients, and you just happen to be, the patient that comes in the last week of the month or something, and we don't have any more slots available for that specialist, we have to schedule you out, and that delays your care. So, of course, if you have insurance, I believe you probably will get faster and better care if you do have insurance.
Okay.
But we don't turn away anybody without insurance.
What other nonprofit organizations have you been a part of or know that provide similar benefits as the San Francisco Free Clinic?
Mayor Gavin Newsom started Project Homeless Connect. I think it's been very successful. I think it had a lot of criticism in the beginning, but people really started to see the benefits of it. It happens every other month, and it provides medical care. It has food. It provides, I think, podiatry. It provides haircuts, IDs, lawyers, books, phone calls. It issues IDs. It provides a wide variety of services, and it's also done by volunteers. And I think it's been a great, huge help to a lot of the population of San Francisco, and we have the largest population of homeless who don't have any other way of getting these services other than the Project Homeless Connect. And even just focusing on the healthcare field because, obviously it's closer to my heart, but, it provides rapid HIV tests. We can test your blood sugar. We can give you medications again that were donated, and have you come back every month or every, 2 months to follow up. So I think it's also a very great help for those who are living here who don't have insurance, who are homeless, or, the low-income population as well.
All right. And now that you finally became a doctor, do you see yourself coming back to San Francisco Free Clinic and pursuing as a volunteer?
Absolutely. I think that a huge part of becoming a doctor is not only, looking for that insurance or looking for a certain amount of, getting all these patients. I think a huge part of it is trying to help the population that really can't afford health care. I think everybody should get health care. I think, our health is the most important thing, and I definitely plan to volunteer to give as many available spots to patients who will be referred through the free clinic. And I definitely want to give back to my community as well. I grew up here, and I want to help the people who live in San Francisco. So yes, it's definitely my plan.
All right, Rina, thank you so much for an informative interview, and I want to thank everyone else for viewing this video. This has been an educational experience for myself, and I hope for everyone else. So if anyone has any questions, please ask via the YouTube or the Google Plus section. Thank you so much.
Thank you.
Thank you, Rina.
Thank you.